So there is a basic skincare routine that I recommend everybody consider. And this is really something that if this is all you do, that's all you technically need to do. We actually took people who really weren't doing a ton of skincare. We put them on this routine. It literally took 2 minutes a day. And they found that after the span of 2 months, we actually surveyed people when they looked at their before and after photos, and they said that they looked about 5 years younger. So now, if you do this routine, Stephanie, you're not going to look 5 years younger because your skin's too nice. Okay. But other people who maybe have a little more aging of their skin, they can really see some changes with it because it will reverse a lot of the aging. So you start off in the morning, you want to cleanse your skin. You want to choose a cleanser that's appropriate for your skin type. So
one cleanser or two cleansers?
Start with one, in the morning, but we'll talk about possibly two at night.
Okay.
So you start off with a cleanser appropriate for your skin type. If you've got oily skin, then you want to look ideally at more of a foaming cleanser. If you've got drier or more sensitive skin, then look for a more milky or a hydrating cleanser. Second step in the morning is to apply an antioxidant serum. I mentioned earlier that one of the main causes of aging of our skin is oxidation or free radicals. And these are essentially molecules that can damage the DNA of your skin, and they are neutralized by antioxidants. The most popular antioxidant, both by mouth and by application, is vitamin C. So vitamin C basically neutralizes free radicals. And so after cleansing the skin, I recommend using a vitamin C serum. Here's a little hack for you. If you combine vitamin C and vitamin E, you can get a synergistic effect. And there are some skincare lines that do have a combination of vitamin C and vitamin E. That's one that we have. That's actually our top selling product at Youn Beauty is our CE antioxidant serum. Now, vitamin C and antioxidants are made to protect your skin from free radicals. You can get some other benefits. They may help to lighten dark spots a little bit. They may brighten your skin a little bit, but mainly they're used to protect your skin. After you apply the antioxidant serum, then I do recommend, especially if you're going to be out, to use a sunscreen. Now, we can talk about sunscreens because, we have friends who are natural medicine docs.
There's so much controversy or controversy.
Yeah, so we can definitely talk about that because I've got my opinion and I think it's fairly measured. But in general, if you're going to be out in the sun, I do recommend using a sunscreen, at least SPF 30. We can talk about the different kinds and stuff like that.
Okay.
In the morning, if that's all you do, you're good. Okay. Cleanse, antioxidant serum, sunscreen. In the evening, super important, you have to cleanse your skin. For those of you who only want to wash your face once a day, then do it at night because you have to get rid of the day's worth of dirt and grime and pollution. Now, as far as a double cleanse, a lot of people will double cleanse at night to get rid of makeup. Okay. So, you've been doing podcast interviews all day. You want to wash that makeup off. A lot of people will start with either a micellar water to help clean off the makeup or with a makeup removing oil cleanser.
Yes, that's what I do.
So
yeah.
Good. Yeah. And that helps to get rid of the makeup, helps get rid of the dirt. And then you follow that up with a traditional cleanser like the one you used in the morning. Okay. You can really get your skin nice and clean. After that, I recommend an anti-aging cream. And there's two that I would recommend. The one that most doctors will recommend, dermatologists and plastic surgeons, is a retinol. Retinol is a derivative of vitamin A, and it comes in prescription strength, which is Retin-A or tretinoin, and non-prescription strength, which is retinol. Now, interestingly, the reason why, and I don't really share this on most of the interviews, but because I know you're into the details of this type of stuff, retinol actually will turn into Retin-A after you put it on the skin. Okay, so retinol is the reason why it's over the counter and it's not prescription is because it's technically inactive. But once you apply it on the skin, it switches. There's a chemical reaction that occurs. And it goes from retinol to retinal, and then from retinal to tretinoin, which is the actual prescription strength. And the reason why tretinoin is only available via prescription is because it's actually active. Whereas retinol turns into it, but when you apply it, it's inactive at the time.
And are the strengths comparable? Like if you have a retinol? No. Okay, let's clarify that. Yeah.
Because tretinoin or Retin-A is available in three different strengths: 0.025%, 0.05%, and 0.1%. Whereas retinols can go anywhere from like 1 to 5%. So it's very different. It's not apples to apples, but suffice it to say, retinol eventually becomes tretinoin. The prescription strength essentially becomes that same substance after it has converted into it after you apply it on your skin. So anyways, if you ask plastic surgeons or dermatologists around the country, if you could pick one anti-aging cream, they would pick retinol. And the reason why that is so important is because it's been so studied. And there are studies that show that using tretinoin, so the prescription strengths, the studies show that it can help to thicken the collagen of your skin. It can reduce fine lines. It can lighten dark spots. And it can even reverse early pre-skin cancers, which is something a lot of people don't realize. You know, if you've
Wow, I
got
didn't know
a
that.
history of skin cancers, then the prescription strength can actually potentially reverse early pre-skin cancers. The problem is you're never going to know what it reverses because it just won't come up. But that's something, if you have a history of skin cancer, I do recommend. Now, the problem with retinol and tretinoin is that it can be irritating to the skin, and some people just don't tolerate it well. You know, you can try the purging. You apply it, you're going to start purging. That's normal. And the idea is that you get active inflammation to eventually get rid of chronic inflammation. It's this kind of weird thing where you purge your body, it gets inflamed initially, and then eventually it settles down, and then it actually will chronically reduce, or it will long-term reduce chronic inflammation.
It's just like exercise. Exercise acutely,
Yes.
gives you heart arrhythmias, increases your blood pressure, increases your blood lipids. It actually looks really bad on paper when you exercise. But the long-term, sort of adaptation is that your heart rate lowers, you have better blood pressure, you have better respiratory blood perfusion, all the things.
And so much of this is the hormetic effect. We just don't talk about it that way in plastic surgery and dermatology. But yeah, so anyways, retinol would be the first choice. But if you've got real sensitive skin, a lot of people don't tolerate retinol that well, in which case the one that I recommend is called bakuchiol. Bakuchiol essentially is a alternative to retinol. And there was a study, a relatively small study, that compared the two head to head and its anti-aging benefits and found very similar benefits from bakuchiol as you get from retinol. But the one difference is that you had less irritation of the skin with bakuchiol. And so that's become a real hot ingredient now over the last couple of years in skincare. We recently introduced our own peptide and bakuchiol moisturizer because we knew that we were, our number two top selling product is our retinol moisturizer, but we knew that there are people who just couldn't tolerate it. And the bakuchiol definitely is a really good option for those who can't. So for a night, once again, you cleanse your skin, you get rid of all that dirt and grime and makeup and everything, and then you apply an anti-aging cream. Retinol is the easiest one to find for people who, let's say, don't have access to a dermatologist or med spa, or they are on a real strict budget. Then you can usually find a pretty inexpensive retinol at department stores and things. And then if you want to apply a moisturizer on top of that, feel free, but you don't have to. There is this fallacy that using moisturizer will reverse aging of your skin, and it just doesn't. Moisturizer essentially is for comfort only. And yes, if you apply it on your skin and your skin is so dry, it can help to plump your skin. It will make you look a little younger, but it's not going to technically physically make your skin younger like, let's say, retinol and bakuchiol may be able to. And really, that's it at night. Cleanse, anti-aging cream, moisturizer as needed. And then the other step that I would recommend once a week if you have sensitive skin, twice a week if you've got quote unquote normal skin, would be to exfoliate your skin. And you can exfoliate your skin in one of a couple of different ways. You can use a gentle exfoliating scrub, or you could use like an enzyme type of a peel. There's a lot of over-the-counter kind of peel type agents that you can get. Both of these will help to get rid of that upper layer of dead skin cells.
Is that like AHA?
Yeah, like AHA peels. Yeah.
Okay.
Yeah, or glycolic. Yeah. Just kind of over-the-counter stuff, light stuff. You don't have to go to a dermatologist or a esthetician to have that done. But then, so it's important to realize that what that does essentially is it gets rid of that upper layer of dead skin cells. And what that will then do is send a cellular signal to the deeper layer of skin cells to turn over more quickly. When we're younger and our skin is nice and youthful and smooth and taut, our skin turns over once every about 6 to 8 weeks. But as we get older, that process takes much longer, and it starts taking 8 weeks, 10 weeks, 12 weeks for the skin to turn over. By regularly exfoliating your skin, you can cause that turnover process to start getting back into gear and turning over more quickly.
That is awesome. So this is like a basic routine for anyone. Anybody can do this morning and night. So the morning is the cleanse, antioxidant, the sunscreen, which we're going to put a little asterisk because we're going to come back to that. And then the evening is a cleanse again. So, either the same one that you use in the morning, or if you have, like I have makeup on right now, so I'm going to want to take this stuff off in the evening. Add the retinoid, so either the retinol or the tretinoin, and then optional moisturizer, but it's just for comfort. And then once or twice a week, you're exfoliating with either a mechanical, like a mechanical scrub, or an enzymatic scrub.
Perfect. Yep.
Okay.
That's exactly it.